Hi, everyone. I'm Deborah Kahn, the founder and executive editor of Being Patient. Today, we're teaming up with Charter Research, which is a clinical trials research center outside of Orlando, Florida, to talk about the latest in clinical trial research. Immunotherapy is going to be the topic today. For those of you who don't know what immunotherapy is, it's basically giving people a drug to boost our immune system in order to combat disease. So joining me today is Dr. Jeffrey Norton. He is a principal investigator for Charter Research, and Lynn Barnes. Lynn is actually participating in an ongoing clinical trial happening right now. Thanks to both of you for joining us today.
Thanks for having us.
Welcome. So, Dr. Norton, I want to just start with you and talk about, BAN 2401 is the drug we're talking about. It's currently Eisai's drug that is undergoing a phase 3 clinical trial. Just explain to us really, what is the drug actually trying to do? What is the research behind it?
Well, so first of all, in memory impairment due to Alzheimer's disease, the believed mechanism or pathologic mechanism is the formation of abnormal plaques in the brain, which are made of a protein called amyloid, and also a thing called tau tangles, which is another form of tangled protein. And we've actually known about the presence of these for over 100 years. And Dr. Alzheimer himself, for whom the disease is named, first noticed this in a patient after they had died. It's been during this last 100 years that we've been trying to understand, where does this come from? We've made a significant amount of progress there. So now we've gotten to the point where we actually have an antibody, which is an immune therapy against amyloid. So it's an anti-amyloid, if you will, drug. The belief being, oh, go ahead. I'm sorry.
No, sorry. And so I just wanted to emphasize, so, some therapeutics are looking to actually break down the plaques directly, but this one is actually saying to our immune systems, you fight it. Is that the right way to say it?
It's sort of like taking some immunity from the outside of the body, and then, yes, your body would then utilize that to block the formation of new amyloid and hopefully undo what's already there.
So drug companies seem to be increasingly bullish, for lack of a better word, on immunotherapy. Why is that?
Well, I think that, it started first with anti-cancer drugs, and then many of the autoimmune diseases, where they found drugs for, say, rheumatoid arthritis, for example, colitis, and of course, again, in cancer. And logically, it would follow that if you could find an anti-anything antibody, that you could target any pathologic or degenerative process, in this case, amyloid, plaque, and Alzheimer's. So I think the success with anti-cancer and anti-autoimmune drugs like rheumatoid arthritis drugs has led people to have excitement about this as well.
And people such as Lynn Barnes are currently undergoing the trial. Lynn, tell us a little bit about your memory loss. When did you first discover something may be wrong?
The best I can pinpoint it was last year, October. And I was sitting at the dining room table doing paperwork, and I couldn't put my thoughts together. And it just didn't seem right to me. And I kept talking to myself, wondering what was going on. So I put the paper aside and came back the next day or whatever and could do the work. And I just couldn't understand what was going on. But that is the one time I can tell you I realized something was wrong.
So did you have a history of Alzheimer's in your family?
Yes. Both of my parents, who are deceased, definitely had it. They died in their 60s. Their parents probably died in their 50s and early 60s. So I can't really tell you how far back it goes, but it's definitely in my bloodline, in my family.
So was Alzheimer's, it was such a strong family history. I imagine that in your lifetime, you thought, oh, I could quite possibly end up with this disease?
I probably just hoped I never would, but sure. I have inherited other things from my family for disease, cardiac problems, diabetes. So I would be fooling myself if I thought I didn't have this. I'm definitely sure I do have it. It has escalated in those 6-8 months. And I'm very, very happy to be in this study.
So have you actually officially been diagnosed with Alzheimer's? Or, I mean, a lot of people first get the diagnosis of mild cognitive impairment, or MCI.
That is what I've been diagnosed with. To my knowledge, that's what I've been diagnosed with.
If I could interject a little bit, you know, at this current time, there is no one test for Alzheimer's. For example, there's not a blood test, but rather there's a constellation of signs and symptoms. So the history that Lynn gives is very important, a change in your level of memory function. But then there are things such as a PET scan, which she has had and which other patients have, often in the setting of research. And many of these things will point in the direction. So oftentimes what we say is we say, this person, such as Lynn, has mild cognitive impairment, most likely due to Alzheimer's, because at this point in time, we can never say 100%. Now, that being said, 3 out of 4 people who have dementia are going to have Alzheimer's. And then when you pair that with family history, which we know does, in other words, it does run in families, it looks more and more as though that's what is going on. I just want to, go ahead.
So, Dr. Norton, would it be accurate to say that immunotherapy should only be used for an earlier stage of either MCI or early stage of Alzheimer's, or could immunotherapy possibly reverse the impact of neurodegeneration?
That's a good question. What I was going to say after Lynn had told her story is I wanted to commend her on being open-minded and proactive, because I think altogether too often what happens is people will ignore an episode like that. Obviously, it was very upsetting to her, and it would be to me, or they deny it, or their partner denies it. And so, yes, early intervention is believed to be the way to go. The concept would be, if you can slow this process and or potentially reverse it, you would want to try to preserve where you're at, rather than deny or ignore.
One of our viewers is asking, which is on this topic, like, how is the immunotherapy administered, and how would you know when to start? I mean, we all, as we age, think we're losing our memories, right? She's asking, after someone's already exhibiting memory loss, or could you possibly intervene earlier if plaques are detected?
15, 20 years before any symptoms. But in most medical conditions, we don't test for things that don't manifest as a symptom. That may change. There is some work being looked at other ways to detect amyloid. But basically right now what we do is we rely on a patient's history to say there's been a change in the way I make memories, or I'm unable to make memories, or a change in my function. But again, I think it's a matter of educating people to know what is normal memory loss for aging and what is not normal.
Absolutely. And we're getting questions in right now. Someone's asking, is it possible that someone like Lynn could actually have another dementia? I mean, we know, Alzheimer's is the most prevalent kind of dementia, but often people are misdiagnosed. They could have Lewy body, they could have frontal temporal lobe dementia. So if it's a different type of dementia, does it all start with early memory loss and plaques? And could an immunotherapy possibly work for all dementias?
No, not all people who have dementia have plaque. So, for example, in this study, and Lynn, you can probably agree, there's a fairly rigorous, what we call screening process. You have to have a PET scan, blood test, and MRI. So basically what we do is we systematically go through all the other things that it could be. So at the current time, Alzheimer's is what is called a diagnosis of exclusion, although there's genetic testing, and the PET scan really points you in the direction, and of course your family history and other things. So could it be something else? At this point in her workup, it's quite unlikely. But yeah, if you're losing your memory and you haven't had any evaluation, it could be anything, right? I mean, that's
yeah. And we have a gentleman in our community who has been diagnosed with CTE. As we know, CTE sets the process of dementia, and I believe there are plaques as well as tangles associated with CTE. Is this something in immunotherapy, if it's an impact that's actually setting the disease process rather than genetics or some other environmental factor, could it treat something like possibly CTE?
That's a great question. You know, anytime a new compound comes into existence, the sponsor who's manufactured it has to choose what indication they want to pursue. So that has not been studied, but it would make sense if, in fact, it's the same, you know, plaque problem, that something that is anti-amyloid could be helpful. But to the best of my knowledge, that has not been looked at.
We have another question about the actual immunotherapy. This lady is saying it sounds like it may work, something in the brain immune system working overtime, kind of like a different kind of cancer. Is it all related? So you've mentioned the success of cancer previously on this talk. Why shouldn't we just assume it's going to work for neurodegeneration?
Well, that's the purpose of studying it. I mean, so as you mentioned earlier, this particular compound, the BAN 2401, is in phase 3. And what that means, it's been through phases 1 and 2. So this particular compound is far along in the process. So we're now at the point, this particular study that Lynn participates in has 1,500 people worldwide. And we're looking specifically at, you know, mild cognitive impairment due to Alzheimer's. And so this is, you know, this is proof of concept, right? So we've now shown that in previous studies, it appears as though this agent does decrease plaque burden. But now the concept is, does that translate to an improvement in overall clinical situation?
Lynn, tell us, why did you decide to join a clinical trial? I mean, it's a big decision.
Not only for my own knowledge, but for my knowledge for my children. I have children and grandchildren, and I really wanted them to be aware. I'm not keeping this as a secret. It is part of my life, and I just want everybody to understand I am trying to do what I can to pass on information. I'm a diabetic heart patient. I've passed that information on to my family, and I feel that this is very important for them to know.
What tell us a little bit about what it's actually like to be in the trial. I mean, I know you're getting infusions, right? And so tell us life in the day of Lynn going on to a clinical trial. What does that look like?
Well, I have to say the very first one was kind of scary. I wasn't sure exactly how I would physically react to it, emotionally react to it. I've had my times of crying and spells and, you know, that kind of a thing. Realization has hit me. I know what I'm doing. I feel good that I'm doing something positive, and I keep my family informed with everything that I know. As far as doing it with this group of people in this study, I couldn't have asked for a better support system. I have a wonderful support partner in my study, and very knowledgeable, and when I kind of falter, she can just be there with me, talking me through it and helping me and figuring out the right questions to ask. Because I'm only one little brain here, and I need help from others to know what to ask. I'm not a physician. I'm not a nurse. I'm just a female mother, grandmother, and I want to know for my family.
Yeah, it is. That's an incredibly great gesture and testament to the love of your family. So we're getting questions in, Dr. Norton. I want to ask you, one person is asking if they can still get into the trial. So tell us a little bit about the requirements. Who gets to enter this trial? I mean, I know there's probably a lot of criteria.
Yes, well, of course. So there are lists of what are called inclusion and exclusion criteria. So for example, for this study, you have to be between the ages of 50 and 85. and you have to manifest symptoms like Lynn has described. But it isn't just that simple. There are fairly extensive cognitive tests. First of all, I think it's important for people to know that all of the evaluation that you would get in participating in an Alzheimer's disease trial is free of charge. And the other thing is that you actually get evaluation that you can't get even from a very sophisticated neurologist. It's just not available to the general populace. It may be someday. And that includes things like PET scans, genetic testing. So you have to meet many, many criteria. That's why I was saying to Lynn, you know, I'm sure she would agree, it's a fairly rigorous process. But a large number of people actually don't get in for various reasons. They may have medical problems that are not allowed, or blood tests that don't pass, and the like.
Okay, and we're getting more questions about the specifics of this trial. Someone is asking, what stage is the trial in, and how long is it really before it becomes turns into prescriptions for people? So obviously, you know, through phase 3, it has to be deemed effective. Tell us a little bit about that process. When we're going from phase 3, how long will that study last? What do you need to? What kind of data do you need for this to turn into medication for people?
Right. Well, ultimately, that's up to the FDA. But this particular study, from the time you enroll until the time you finish, is 18 months. And the reason that this study is so long is there's a 6-month, what's called extension phase. So the last 6 months of the study, every subject is actually getting the experimental or what's called investigational product or drug. And that's a little unusual for many studies. In most studies, neither the subject nor the investigator know if you're getting what's called a placebo or the actual drug. So that's one advantage to this particular study. So they're still enrolling. They're looking for 1,500 subjects, and we're at approximately 11 or 1,200. So about 2/3 or more have enrolled. So they probably will be enrolling for a few more months, but it's hard to know, as you know, it depends on how many people qualify. And as we were saying, it's a little bit difficult to get in, but certainly absolutely worth trying.
And the more people who sign up, the faster we're going to know if this medication works.
Exactly. So right. So then, for all those people. So think about it as a rolling admission. So when the very last person gets in, it's 18 months from then. Right. So that alone means the study is going to go for another 18 months to 2 years, and then it will depend on the data they gather, and then of course the FDA has to review it and approve it. So it could take a few years, but it is looking promising based on previous studies.
Yeah, and just apropos to that point, we have another comment coming in saying, my wife Linda is enrolled in the BAN2401 study, the study that we're discussing today. She was previously enrolled in the Eisai aducanumab, that's the Biogen actually, and Eisai study, aducanumab, which is also another immunotherapy, which was stopped in March 2019. 100 days after the last infusion, she had her first and second seizures. Those seizures eliminated her from inclusion in the restart. She's thrilled to qualify for the BAN2401 study. In the prior study, she was diagnosed with Alzheimer's after the MRI and 2 PET scans for the beta amyloid and tau tangles. My question is, out of 100 patients, how many will receive an actual dosage and how many will receive a placebo? So, what's the proportion?
Well, right. There's 2 answers to that question. As we said just a moment ago, all patients who enroll in this study will get the drug the last 6 months. The portion of the study that's the first 12 months, we will not know, but it will be 50-50, placebo versus the actual drug. And that's the concept of double blind. So neither Lynn nor I, for example, know what she's getting right now. I know because she just started the trial recently that approximately 12 months from now, she will start receiving the drug. So again, everybody gets it. The question is, who's getting what in the beginning, and that's on purpose, right? We need to be able to study placebo versus the product.
Right. And Lynn, we have a viewer asking you if you've had any side effects so far.
No, absolutely not. I've only had one infusion so far, and absolutely no side effects.
You didn't feel sick or anything after the infusion?
Nothing.
And how long do your infusions last for? I mean, I imagine you have an IV in your vein, right? And how long does that last?
I was here for quite a few hours, to be honest with you, but how long did it actually take to go in? I can't tell you. I remember I was reading. iPad. Time kind of went. They made it very, very comfortable for me.
We try. I can answer that if you don't mind. The very first time anybody receives this drug, like she did, we have to observe them for several hours afterwards in case there's any untoward effects. The infusion itself takes 60 minutes, so you only have an IV in place for 1 hour. And then what will happen over time is if people tolerate it as well as Lynn has, the time that we have to observe them after the infusion will shorten, because we'll know that they've had exposure and that they're doing well. All drugs that are antibody drugs or immunotherapy run the risk. The most common side effect would be a sensation, say people get after a vaccine, achiness, or maybe a slight fever, or that kind of thing. We have not seen it often. It can happen, and likely if it were to happen, would improve over the course of a few treatments. It generally doesn't persist. But again, that's a fairly low incidence thing, but would be the most likely thing you might notice.
So when we're talking about the duration of the drug, I mean, you mentioned even if you are a placebo, you can have the drug for 6 months after the study. But how do immunotherapies work? I mean, I take it it's not just like something we take once and our immune system kicks in and bam, that's it. Do we need to keep feeding ourselves with these drugs in order to eliminate and attack the plaque? And how much medication, like let's say the BAN2401 study is successful and it does turn into medications that can be administered, do we have to be on these medications for the rest of our lives, or do we know that yet?
We don't know that yet. And I think that's part of what we're studying is, number one, what does reducing what they call plaque burden mean in real life? What would that mean to someone like Lynn in terms of what's going on right now? There are many antibody medications that do have to be given long-term. That certainly is a possibility for this drug, but that's part of what we're trying to work out. Remember, it's what's called exogenous, or from outside the body. So you're actually, like you've said, boosting the immune system by providing this antidote, if you will.
Okay, and we're getting more questions around the specifics. One person is asking, what are some of the dosages in this particular study? And does BAN2401, is it also targeting the tau tangles? Now we know the presumed pathology of Alzheimer's, it starts with the plaques, then tangles, and then inflammation. So is it attacking both the beta amyloid plaques and tau tangles, or?
No. There are other drugs that are in development that are anti-tau. That's a very savvy observer who knows amyloid and tau. But this is strictly amyloid, which is, of course, part of plaque. The dosage is the same. It's based on your weight. So everybody, because what happens in earlier phases 1 and sometimes phase 2 is they do what are called dose finding studies. They find doses that are safe, that people can tolerate, and then they move on to efficacy, meaning what doses work and what doses are too low, if you will. We're beyond all that. So now we're at the expected dose. So everybody gets the same dose based on body weight.
So one person is also asking about the genetic component of this. Do you have to, we know the Alzheimer's, for later onset Alzheimer's, it's the APOE4 gene. If you have one copy, from one parent that's called heterozygous, and it means you have an elevated risk of approximately 30% more chance of getting Alzheimer's if you live a full lifespan. If you have two copies, that's homozygous, which is giving you really over a 90% chance if you live a whole lifespan into your 80s. Do you need to have the APOE4 gene in order to participate in this study?
Yes, you do. Well, initially, they were taking both types of patients that were negative and positive. But at this point in the study, you do have to be positive for that genetic test, correct?
So you can have either one or two copies, or right. You need both, one or two?
No, you can, right. You just have to have the presence of.
Why is that a criteria for some of these Alzheimer's studies? Why is the genetic component so important to research?
Well, I think like we were talking about before, because there's no definitive test for this disease. In other words, it's like pieces of a puzzle, right? You're gathering all of the various things that point you in the direction of the disease. This is one more very strongly associated objective test that pushes you in that direction. So it is becoming more and more common that sponsors that create new products want you to fit that category.
Okay, and Lynn, did you ever know what your genetic status is before? I mean, I don't even know if you know what it is today, but did you ever seek to find out what your genetic status is, given you have such a strong family history of Alzheimer's?
No, I never did.
So, Lynn, Lynn's someone who has like a strong, what about early onset, Dr. Norton? I mean, that's a different gene altogether. Would somebody, and someone in our, one of our viewers is commenting that in a lot of these Alzheimer's studies, you have to be older, north of 50, 60 years old, right, in order to participate. As more people get Alzheimer's, we're seeing a growing population of younger onset Alzheimer's. Right. Is that a whole different ball game, or can they participate in this type of research?
Well, every sponsor that creates a protocol comes up with their criteria. So that could change. In fact, we were discussing this in the clinic today. At the other end of things, it's not uncommon now to be over 90 years of age and fully functional and living independently, but many protocols don't go that high in terms of age. And so what do you say to somebody who's otherwise physically well but noticing memory loss? So I think we may see changes on both ends, both young and old, to accommodate that. It's clearly going to be a bigger problem for society.
Yeah, that we have a couple people who are commenting that they have been diagnosed with early onset Alzheimer's. So another question coming in saying, some experts say that effective treatment for Alzheimer's would likely include a cocktail of treatments. Like it's often referred to as kind of like an HIV type of treatment, where you're not just going for one thing, you're going for a host of of several things. Do you see immunotherapy as a treatment that would be combined with other treatments, or could it actually stand alone?
That remains to be seen. I mean, if we use cancer as an example, it's now very common to target 2 or 3 abnormal processes that lead to a specific cancer. And that might be specific to the type of cancer, for example. So you do often hear combination therapies there, and it would logically follow that we may end up doing that as well. For example, the person who asked about tau. There could come a time when we have anti-amyloid and anti-tau. I mean, I'm speculating, but it does logically follow from what we've seen with treatment of cancer, and very well could end up that way.
Yeah. Somebody who, this is the person who was participating in the BAN 2401 study, has commented that, did I read correctly that after 18 months in the phase 2 study of the 10 milligram dosage, that as measured by the PET scan, they noted a 93% reduction in beta amyloid deposits in the brain of the testing group patients. So what were the results in phase 2 that made us hope?
I don't think there was 93%, but there's definitely data out there that administering this drug does reduce plaque burden. But remember, now we have to move on and say, what does that convey in meaningful terms to a patient? What does that mean if you're going through what Lynn is going through? And that's the purpose of this phase 3 study, is to see, does that translate, for example, to better cognitive testing, better function? It's a tough thing to study, but we have a good protocol in place to do just that.
And Lynn, tell us a little bit about what you talked about when you first realized there was a problem. But in recent months, do you believe, I mean, I know you just started the drug, so it's probably too early to tell if it's having any impact. But tell us a little bit more about what you've experienced in terms of memory loss, because I know a lot of people out there, you really reach that point where it's like, okay, we're aging, it's memory loss. You think that for a while until something that you described happened. So tell us a little bit in more detail about what actually did happen to make you think, okay, now there's a big problem.
You're exactly right. I just could not put my thoughts together this one evening, and it just did not make sense to me. And I put my paperwork down and I walked away from the table, and I came back, and I could do it. And I didn't understand what was happening. But when I thought about it more and more, both of my parents had something, dementia. Mother died at 64, dad died at 67. I'm 73. I don't know what they would have been like if they were my age. They had a harder upbringing than I had. I had a lot more advantages than they had, economically and physically. So it's just something that I feel really strong about with my children. My children are, reaching 50 years old. I have many grandchildren out of college even, and I want them to be aware of what is going on in the world. Luckily, we're able to live healthier, active lives a lot longer. And you have a life that you want to be physically and mentally able to endure. And that's what I'm trying to do for myself, but certainly for my children and grandchildren.
Did you, once you realized that you may have a problem with your memory, did you change your lifestyle, or have you always been quite a healthy person?
I've been a diabetic heart patient for a lot of years. So am I a healthy person? I'm as healthy as I can be. Both my father was a diabetic and heart disease. My mother had heart disease. So I am definitely learning from their experience and what I've seen them go through, and trying to keep myself in the best shape I can physically and mentally for as long as I can. I know it's longer, and I want to be able to enjoy the life I have and not be overwhelmed by it.
Yeah, absolutely. And of course, what Lynn is talking about, Dr. Norton, are comorbidities that we often see with people who have been diagnosed with Alzheimer's. Neurologists love to say what's good for the heart is good for the brain. Diabetes, again, another really high risk factor for this disease. So are most of the people you're seeing, do they also have these type of comorbidities who have enrolled in the study?
I think it runs the gamut. Lynn had a cardiac event at a fairly young age, but has done remarkably well. We see people who have, ironically, no other medical history, and then also have cognitive impairment, very likely due to Alzheimer's disease. So certainly controlling your sugars, controlling your diabetes if you know you have it, clearly makes a difference. Eating a diet that is, based in plants and less, saturated fat is likely very helpful. But truthfully, it's a very high prevalence disease, and the older you get, the higher the chances are you'll develop a form of dementia. And it, like I said, can affect people who have no other obvious medical history. But what Lynn says is very true. She's very careful about what she eats because of her diabetes, and that will only help her memory problem.
Yeah, and another question is coming in about, given that many anti-amyloid clinical trials have failed, what gives you hope that this one will actually work? I mean, there's still a lot of debate, let's face it, in Alzheimer's research. What's the right target to go after? Most scientists have chosen beta amyloid plaque, as we've seen in past research. But does immunotherapy shed a new light on this? Does it give us more hope?
You know, that's what we're working on. All I can say is that the phase 2 trials looked very promising. They wouldn't have advanced to this point if they didn't. But again, it's that concept of, you know, does this mechanism of action translate and solve the problem, or is it part of the problem? You know, that's exactly what we're looking at.
Okay, and we look forward to the results. If people want to inquire more about how to participate in this trial, or for that matter, I mean, there's you know, quite a few Alzheimer's trials that are going on and those in the pipeline. How do they do that?
There are many ways. You know, you could start locally. You could search for research companies in your area. So, for example, if you were in the greater Orlando area, you could look at our website, you know, charterresearch.com. But if you're not sure even how to do that, there's a federal government website called clinicaltrials.gov. And basically what that does is it allows you to type in a disease and your location, and it will tell you what's going on and where, and we'll give you a summary of what does that study actually mean. Most major metropolitan areas have organizations like we do that conduct clinical trials. And for example, this study, you know, BAN2401 is worldwide.
Yeah, and that was actually someone asking, is it just in the US? No, not at all. It's worldwide. Lynn, how did you find out about the BAN2401 study?
I think, to the best of my knowledge, is reading the local newspaper that I have here. And I saw the ad a couple different times, and I read it through it a couple different times, and I like to talk to myself in my own head, and I made a phone call. And I mean, that's basically how it
did.
Is it, were you seeking out a trial, or was it just that ad sparked a, you know, something saying, oh, I want to participate in this?
I knew something was going on, and I knew that I wanted to do something about it and find out what it was. So yes, the ad definitely sparked. And making the phone call, and everyone at Charter were just so wonderful and willing to talk to me. And the first thing I said is, if I'm a candidate, I wanted to be a part of it. And I'm thrilled that I am. It is, I feel like I'm a realist. I want to be able to give the most information I can to my family, to my husband. I have to say, he's definitely scared. The kids are scared. I understand that. But on the other hand, this is my life, and I need to do the best I can. And Charter has been phenomenal to me.
And we are, I mean, I have a mom with Alzheimer's, and like to say to you, thank you for wanting to be part of that cure. I mean, we all want to find a cure to Alzheimer's, and, you know, it's people like you who really are helping us. So, you know, from me, from I'm sure many people in our audience, thank you, Lynn, for your participation. We need more people in clinical trials in order to find a solution. And to Dr. Norton, thank you for your work. We'll post on this Facebook thread the link to Charter Research. I know we had a lot of questions. More may come in. Unfortunately, though, we don't have a lot of time left. So what we'll do is we'll redirect any questions to you, Dr. Norton. I hope you don't mind, should our audience continue to have questions. But from being patient, and of course in partnership with Charter Research, we thank you both for your time, for your knowledge in informing us. We want to know the latest on clinical trials, and thanks so much for being part of the attempt to find a cure.
Well, thank you for having us. And I want to thank Lynn. I think she has a really good attitude, and I think that you're being proactive is really an important message to send to people who, like yourself, were wondering, is there something going on? Again, early intervention and education of people, I think, is really key to moving forward here.
Absolutely. So if you missed any of this interview or you would like to watch it on demand, you can go to beingpatient.com. Like I said earlier, we'll also post the link to the Charter Research page should you want to inquire about future trials or current trials that are happening. Thanks very much for watching. I found this a really informative conversation, and thanks to both of our guests and to our partner, Charter Research.
Thank you.